right. Well, good morning, everyone, and thank you for joining us for another Holzer Highlight. My name is Dr. Mathis. I'm a pediatrician here at Holzer, and today I am joined with a very, very special guest. We have Dr. Ramtekkar, who's a child psychiatrist, who is a psychiatrist first and foremost, specializing in adolescent and child psychiatry at Nationwide Children's Hospital. And today we wanted to talk about anxiety and depression, but especially in the age of COVID. But before we get started, Dr. Ramtekkar, if you'd like to introduce yourself and kind of give the public a little bit more insight in your background.
Hey, good morning. Thank you so much for having me, Dr. Mathis. This is Joel Ramtekkar. I'm a child and adolescent psychiatrist. I'm also the associate medical director for our pediatric accountable care organization, where we are responsible for about 400,000 children in 40 county area in Southeast Ohio. And I'm also the medical director for virtual care at Nationwide Children's Hospital, and glad to be here.
Well, thank you again for joining us. You know, the past year has been a whirlwind for everyone, but I'd like to talk about the effect that COVID-19 and the restrictions on everyday life that have been imposed in order to cut down the rate of infection, how that's affected anxiety and depression. Over the past year, emergency department visits have gone up for anxiety and depression for not just for children, but also adults, but specifically for children. Have you specifically seen, or I should say, how has COVID affected, the families and children that you see with regard to anxiety and depression?
Right. As you said, this has been an extremely uncertain time, and at some point there was a point of crisis as well. And because of a lot of stress, a lot of children, youth, young adults, and adults as well have been going through a lot of stress. And feeling anxious and down is a normal reaction during the times of uncertainty and crisis. But kids and young people might be experiencing a variety of other feelings as well in response to this COVID-19 pandemic, and that might be anxiety, distress, or low mood. And this is important to understand that sometimes these are normal responses to an abnormal situation. Mm-hmm. But what we've seen overall is there has been increase in the rates of anxiety and depression, or severity of anxiety and depression, that's leading to more emergency room visits, more difficulties coping with the emotions that they have never experienced before in response to this, or increased vulnerability that is then causing development of anxiety and stress disorders. And there could be many reasons likely for that. I think a couple of things include this trauma of widespread disease, fear of getting sick. Mm-hmm. We have this 24-hour news cycle that is telling us about losses of life, and there's a grief, even if you're not related. And God forbid, if there has been someone who you know has been a victim of COVID-19, then that grief also is stressful. A lot of physical distancing in social isolation, and particularly for teenage, it's such an important phase of their life where they really need to socialize, be with their peers, and that's very important for their social emotional development. And this unprecedented social isolation because of physical distancing is extremely, extremely stressful. And what it leads to is the loss of community and reduced access to caregivers. Because remember, for a lot of young adults and teenagers, the safety net is not only with their parents and families. Sometimes it's their friends, sometimes it's their coaches, their teachers, and now that's all kind of gone before it became a little bit normal again in the past couple of weeks. So I think overall, it has been affecting globally, causing a lot of those increased anxiety, depression, self-injury, or just hopelessness that's been going on.
And those are really, really great points. And I think COVID-19 has highlighted the importance of the social connection, that children have, and also parents and caregivers that they have in certain outlets, that with, just like you said, daily stresses, daily there's a normal level of certain, feeling like a low mood or feeling nervous, or, if you're anxious about a test or something like that. But COVID-19 has just really, highlighted just how important sports activities, going to see friends, really just helps to deal with some of those emotions just from day-to-day stress. And then, also there are children who are maybe naturally predisposed or at risk for developing depression or anxiety if they have, if their mom or dad has anxiety, or a sibling has, another type of, mental health disorder. So, what about how I would assume that this would pertain for those who are naturally at risk for anxiety, depression as well. If you think about, ADHD, we see, a lot of families, a lot of children with ADHD, and depression and anxiety are common comorbidities that are seen with it. Have you noticed an uptick within children within that population, whether it be or just from chronic diseases? If I have a pulmonary issue, if I have really bad asthma, or I have a cystic fibrosis, I can't go out, I can't mingle, I can't do these things. Children with varying degrees of autism who may internalize external stimuli, very, very different. Have you seen an increase in anxiety with those children, those families?
Yeah, you bring up a very good point, Dr. Mathis, about the co-occurring disorders that we don't necessarily look at as anxiety, depressive disorders, but ADHD or chronic medical illnesses. Absolutely. When we think about development of anxiety or depressive disorders, we're always thinking about G by E, genetics by environmental influences. So the kids who are already at genetic risk of developing these disorders, now when we add the environmental stresses, that's when they are more vulnerable to develop these disorders. And I think this has been a perfect combination. This is one of those environmental stresses that could trigger. So short answer is yes, it could certainly lead to more anxiety and depression for kids who are more vulnerable. So now with kids with ADHD and chronic medical illnesses who do really depend a lot on the resources, whether it's for their academic support, social support, or care for their medical issues by multiple providers. Now that that's all gone and they feel much more socially isolated and really feeling that they're on their own in struggling with what they have been struggling with for a long time, that can obviously make them at more risk for anxiety and depression. What we have also known that if we do not proactively address the anxiety and depression in chronic medical illnesses, then the outcomes of those chronic medical illnesses themselves are not good. And so it's very important that we are vigilant about the signs of depression and anxiety in these youth, so that we could go ahead and equally give importance when managing the whole child, not just the medical, physical piece, but also the mental piece.
And in addition to that, because of the fact that a lot of the families that we see, a lot of children that we take care of, they have these underlying conditions. Using every opportunity that they come to the office, no matter what it's for, if it's for a foot injury or if it's for, whatever the case, well visits, it's very important that we, touch base on how are you dealing with, COVID-19, right? Meeting them where they are, depending on if it's a 5-year-old child versus a 17-year-old teenager, that conversation may look very, very different. And sometimes the symptoms, or oftentimes the symptoms of anxiety and depression, look very different from a younger child. And yes, young children can experience varying degrees of anxiety compared to teenagers. Can you talk a little bit about the varying symptoms, the versus younger versus the older children? How does that look, or what are some of these symptoms that parents can look for in order to detect anxiety, depression in their children?
Sure. Again, very important point that the kids are not little adults,
Right.
and they go through different developmental stages. And we think about a very young child, like preschoolers, then elementary school age children, and then we have teenagers.
Right.
And they all kind of react differently to these stresses. Even if the underlying issue is depression, anxiety, the presentation could be a little bit different. So let's start with the very young kids. And whenever there's crisis like this, when there's this sadness and anxiety, the three things that they're always thinking about is, am I safe? Are the people who care about me, my parents, are they safe? And how is this going to affect my daily life? And so they're worried about normal routine, safety of their parents and their own safety. And that can present as more clinginess, sleeping difficulties, a little bit of irritability, maybe increase in bedwetting, separation anxiety from their parents, and then really having an emotional roller coaster where you suddenly burst into crying spell or have an outburst from a seemingly minor issue, or even not even an issue. I think a good example is I'm crying about a banana that I don't even like. And that emotional sense of no control is how that can present early on. The school age kids are a little bit different. They now are understanding, they're a little bit more aware of what's happening, and they could have intense feelings, and they could have this sense of impending doom. They just don't know how to manage their own feelings. They have increased trouble with eating. They might appear low in mood, report worrying, and could have a typical crying or moping around and not having any desire to do anything, and intense, out of proportion reactions, like excessively crying, unsolvable crying, or having almost a panic mode about seemingly minor trigger as well. When it comes to teenage, again, teenage is not just one developmental stage, it's kind of developing. And so when we put in the mixture of puberty and the body changes and the hormonal nature to the depression, it becomes a little complicated. They could be more withdrawn, they could be irritable, they could be distant, avoidant, not participating in family, suddenly not enjoying the things that they really like to enjoy. And in these cases, from video games, hanging out with friends, texting, face chat,
Right.
all the things that they would like to do, they're not doing anything. But then functional decline, as evidenced by declining grades, because now there's just no desire, no motivation, and declining performance into different activities that they were really good at. And then in some intense cases, particularly in adolescence, this existential crisis about what's the point of life, is there anything there's worth living for, this passive death wishes, hopelessness, and sometimes suicidal ideation, which is the more extreme of many cases.
And to add to that, with the declining grades, now parents are needing to become teachers. And that's a whole different dynamic of this informal nurturing relationship that we have now to a more structured, and not to say that being a parent is not structured, but it's just different, right? So now we have to be teacher. Now we have to get the concepts and of their education, not taking into account, let's say I'll bring up ADHD again. If your child has ADHD, now you're seeing them, how difficult that interaction could be with staying focused, staying on task, the comprehension, and if it's undiagnosed, maybe it's something they were concerned about, but they haven't done anything about it. Maybe it's more apparent at this time, or, if they are being treated for it, maybe there can be some nuances there. As well, that added stress and tension that it can build, it's very, very important as well. Anxiety and depression, there are different degrees of that, right? So the difference of, and I think it's level of impairment, but I would like to get your opinion and or your comments on what's the difference between, or how does a parent decipher my child is anxious, or they're just kind of nervous intermittently about, about certain things, certain events in life, or versus my son or daughter is, down or kind of low mood, versus I think they may have depression. Can you speak on that a little bit?
Sure. So as we talked about some of the different symptoms that anxiety depression can present as, I'll go back to saying the same thing that I said earlier, that sadness and nerves or feeling nervous is a healthy emotion in response to a difficult situation. Because it's important to cope and it's important to adjust yourselves when there is this stressor. The two things that kind of differentiate between the normal healthy reaction or maybe a little bit stressful reaction to a disorder is the severity, where things are so difficult that they're not able to do their day-to-day activities, and two is chronicity, which means that it's not something that somebody can get over within a couple of days, but it lasts for at least 2 weeks and then continues on after that. The third thing after that is it affects not just your mind but also your body, where you're suddenly having difficulty with eating, appetite, and sleeping, where either you have a lot of difficulty falling asleep, staying asleep because you just can't rest your brain, or you're sleeping too much because you're exhausted. Same goes with eating, where you have no desire to eat at all and your body is just refusing to nurture itself because you're just in low mood. Or you're stress eating, where you're using eating as a coping mechanism and engaging in this really inappropriate eating behaviors like binging, purging, and things like that as well. And then eventually, the change that occurs with regard to ability to care for self and ability to function in our day-to-day life is something that parents can notice as well. And here's what I would say as well. As parents, you are the experts in your kids. And
Right.
you can know when things are just time limited. Oh, it's just a reaction to an important stress like a bad grade or failing a class or breakup in older teenagers. Versus, oh no, this is something that's going on even without a sustained or specific trigger, and it's causing them to completely change their personality, and they're just not themselves for quite some time. And that could be an indication of anxiety and depression. And in those cases, so it's a great idea to obviously talk to the doctors, starting with the primary care doctors, and then if needed with the psychiatrists, about getting a better evaluation done so that we can catch it and identify it early and treat it eventually.
And you brought up an excellent point. Parents know their children, and that brings us to the next point. Okay, we've talked about the existence of anxiety and depression, as well as a number of different mood disorders that are out there. These are just the two that we are focusing on at this time. So we know that it exists at baseline. We know that COVID-19 has made it worse. We've talked about, some things that we can look for, but I think sometimes what can happen is that, there's difficulty with bringing up the topic during this time, approaching your child and saying, hey, I'm noticing you're not as engaging as you once were, school, you're not, you're in your room more often, you're not laughing, not smiling like you used to do. How can family, or I guess what would be some techniques that families could use with just approaching the topic and just talking about, COVID-19 in general? What I often talk about in the office is it's important to get a feel of what your child understands, and that questioning and that bringing up that topic may differ depending on where they are developmentally, because like you said before, the news is on 24/7. This is a virus, this is a pandemic that is constantly evolving. New information is coming out. It's important that we talk to our kids to filter some of that information because, maybe they still have a concrete way of thinking about facts, or maybe they're hearing things can't contextualize, or they're hearing from friends. How can families start off with just having that conversation about COVID-19 and how that may be affecting their children?
Mhm. Well, again, I think you bring up a good point about really modeling that behavior and really validating them and supporting them. So, first thing one might do is to approach the kids and ask what they know, because they might have a very different understanding. Maybe they're not taking it too seriously, or maybe they're taking it too seriously and they're afraid that they are going to get sick and they are going to lose their life, or their loved ones are going to lose their life, or they buy into not following all the precautions, or getting to the all extreme and it's like absolutely not doing anything else. So understanding what they know and asking it in a non-judgmental manner is the first good step that any parent can do, because again, you're not talking about how they're feeling, you're not talking about what you're noticing about the child, you're just bringing up a casual conversation about, hey, we've been hearing about this COVID-19 stuff for almost a year now. You've been in school, you're not in school, now you're in hybrid, God knows what's going to happen. Now we're talking about vaccine, you're talking about death, you're talking about social isolation, distancing. It's been really confusing for me as an adult. What do you think is going on? What is your understanding?
Right.
That might provide them with a safe space where they recognize that, oh, even my adult doesn't have all the answers. They just want to hear me out. And that's the first great thing that one can do as a parent. Because despite our innate nature as a parent or as a spouse, where we want to fix things for them, for our loved ones, this is not the time to fix it. This is the time to hear them out. And so it's very important that we are cautiously curious about what they know, and just to hear them. All you're doing is providing a safe space and a psychological safety for them to open up. And if they don't want to open up, it's okay. It's also important to take the cue that maybe they need more space. But you have to say that out loud as well, where you say, well, it seems like you don't want to talk about it this time. Maybe it's stressful. Maybe timing is right. So I'm going to give you some space, but just know that I am here if you need me. I would really love to talk to you about this. And maybe you are getting information somewhere else, and that's okay. Just know that I worry about what's been going on. I myself, as an adult, am affected by it. And I just want to make sure that I share what I feel, and I feel that you should feel comfortable to share it with me, how you feel, what you feel. And so validating the feelings and concerns are very important. Other sometimes things that parents can sometimes do is, in order to show their compassion and worry, they might comment on a behavior rather than an emotion. And I think it's important to separate it out. Don't say, your sleep has been awful, your room is a mess, you're not paying attention to your body, what's going on? Instead, you might say, I'm noticing that you've been really down and feeling low. You're not as engaged. You're not my usual bubbly, happy, or normally engaging. You don't have to normalize happiness all the time, but you're not your usual self, and I'm noticing that. So tell me a little bit about how you're feeling, what's been going on. That way, what we do is we separate their actions and their maladaptive behaviors that's a result of depression, anxiety, from their feeling, and that provides them with a much better step to open up. And one of the most important things, if anything else fails, or as a first step, what a parent can do is to really build on strengthening your relationship. This is the perfect time to strengthen that relationship as a peer, as a friend, and as a which can then lead to much more open conversations and seeking out help from teenagers and young kids.
That's great information. There were so many gems that were in what you were just stating. I think being cautiously curious is really, really good. And I think even outside of COVID-19, when especially as kids get older in their teenage years, they feel that parents can be somewhat intrusive, that they're always kind of needling, always just on them. My parents always on me. It's okay to just be cautiously about a number of different things and strengthening that relationship. And and once again, like we said before, it's not just children, it's adults. Kids can be barometers, if you will, of the emotional state within the household. So even parents taking a step back, or just saying, well, how am I feeling? How is this affecting me? I'm parent, I'm provider. How am I coping with COVID-19 and how this has changed my life? And I think that is an important step, because some of the emotional things or the behavioral things that you're seeing could be just reflective of what you're going through, especially in younger children. Did you want to comment on that at all, just with regarding parents?
Sure. It's important to make sure that you're taking care of yourself, because it can be not only physically but also emotionally exhausting to take care of a child who's struggling with their own emotions and maybe a debilitating anxiety and depression. And it takes a toll on your own mental health as well. And so it's important that you take some time for yourself, introspect, reflect, see how it's affecting, and seek support either from other parents, your partners, or maybe seeking professional help as well. Because it goes back to the typical airplane analogy that we often use, is when you have the safety precautions and warnings that go on when you board an airplane, and when they say, before helping the person in your next seat, make sure you put the oxygen mask on yourself. And it holds true here as well. If you yourself are not doing well, then there could be more harm than benefit that can happen when you're trying to intervene in a not right emotional state. And so it's very important that you really engage in self-care, engage in activities, and engage in some support socially before you jump in and try to help your child.
And just kind of wrapping up, I could talk about this for a long time, but just kind of wrapping up, are there any particular resources that you would like to highlight? A lot of with the American Academy of Pediatrics, the healthychildren.org, the CDC, they have hotlines for children who are for suicidal ideation. We talk about emergency plans, in the offices. Is there anything? Are there any other resources, that families can turn to?
Correct. So I think you have highlighted all of the major ones, Dr. Mathis, the AAP, CDC, SAMHSA also has, SAMHSA also has a crisis hotline, for example, where anybody can call anytime. You can also call your local county crisis hotline as well when you have a child in distress and there is a safety concern. But in general, there are a lot of online resources through AAP, Healthy Minds, Bright Futures. Nationwide Children's Hospital also has On Our Sleeves campaign, and onoursleeves.org has a lot of practical information and short videos for you as well.
And we'll work on putting up those resources on the website and on Facebook. Finally, Dr. Ramtekkar, any final thoughts that you would like to impart on the communities just about this trying time and very stressful time for everyone involved, children and adults alike?
Sure. Well, as we said early on, these are really unprecedented times. This is really a pandemic of century that has come almost after a century. And there's nothing that we have anything to compare with in modern world. So a lot of different things are very new, and we're all on this together. The medical specialists, the medical field, the parents, the schools, the families, the communities. It's very important that we foster resilience and we foster hope, because we are really focusing on our kids, who are going to be the next generation who are going to run the country and the world. And so it's very important that we take care of ourselves in this triumph of recovery from this deadly pandemic, so that our kids could have bright futures.
I think that's great. Thank you so much. And I'd like to say that, in addition to what Dr. Ramtekkar was stating, the pediatric office, the physicians, the pediatric nurse practitioners, we are in the pediatric department specifically, but in Holzer and as a whole, our doors are always open. So we tell families we are here. We are adapting with these unprecedented times in order to keep families safe. Where our doors are open to talk about these different issues via video visits, in person. So if there's a concern, please come to us. Let us help you and at least point in the right direction. We're going to get through this. The only way that we can get through this is together. And I'd like to thank you for taking time out of your busy day to sit down and talk about this is a very, very important topic. And thank you all for watching another Holzer highlight. And Dr. Ramtekkar, please don't be a stranger. Hopefully we can do this again.
Yes, absolutely. Thank you, Dr. Mathis, for inviting me. I will also reiterate what we just said about all your wonderful work in serving the community. And it is really our pleasure to partner with you and Holzer System in supporting the community and children in the quest of their good mental health and physical health. Hope to see you again soon.